gentlemen, it's the One Health Podcast. Welcome back for another week here. It's been a great week so far. We thank you for joining us. I'm your host, Tori Schmelzer. I am a fitness enthusiast / fitness entrepreneur. My goal is to share the knowledge I gathered through meeting industry experts with as many people as I can. For those of you who have not heard the One Health Podcast, each week we are going to bring on different experts in areas of health. So mental health, we cover physical health, professional health, spiritual health, you name it, we cover it. We don't claim to be experts in any of these subjects. We just know the people who are, and we interview them for the greater good. I want to say thank you to everyone for the love and support on iTunes, social media, all that good stuff. Make sure you guys do us a favor, go on that purple little app on your phones, that podcast app. Hit the subscribe button, share it with your friends and family. We really do appreciate the support, and leave us a review. That really does help us in the rankings. Also, stay up to date on all of our latest episodes on our website, onehealthpodcast.com. Shout out to our sponsors, EcoGym and Motivating You. Make sure you guys go to shop.teammotivatingyou.com and sign up for your free macro plan. That is a free food plan. Ton of value there, so go check that out. Also, EcoGym. Act now. These guys are rolling out a revolutionary group fitness class called Surge, and it's going to change the way you think about group fitness. So make sure you guys find a location near you, get in there, sign up for a class today. Today on the show, we have Dr. Brendan Lee. He is from Body Fusion Chiropractic, which is a professional chiropractic, physiotherapy, sports therapy, active release technique, flexion-distraction therapy, and massage clinic. In practice as well online, Dr. Lee and his team strive for excellence through superior patient treatment, education, and satisfaction. They look forward to helping all who visit their Chicago, Evanston, and Northbrook locations. Dr. Lee, thanks for coming on today.
Thank you for having me, Tori.
Really appreciate it. So let's start with a little bit of background so we can give people some context here. What made you kind of get into the chiropractic world, into this field? What kind of made you gravitate towards that?
Sure. Well, I had a lot of sports injuries growing up, and I had been treated over the years and still had kind of nagging chronic issues in the neck and shoulder, and went to a chiropractor, and it helped me out a lot, and that's what gravitated me towards the field. So.
Excellent. So you guys, you and a couple other partners opened up these locations, right?
Yeah.
Is it? Okay.
Yeah. Well, I'm the owner, but I have a few other practitioners that work for me. Yeah.
Okay. Yeah. Gotcha. And you guys have 3 locations right now?
Yes. Yeah.
Okay. So when you were going through schooling and stuff like that, did you know that this was what it was going to be? Like when you first got to college and stuff like that, or did this kind of evolve through the years?
I didn't know that I would have multiple offices. I actually didn't even know that I was going to gravitate towards sports chiropractic, even though I went in for a sports injury. It's just kind of how it evolved over time. The school that I went to on the West Coast, Palmer West, is it's part of the Palmer system, so it's a longstanding chiropractic school, but it is geared more towards sports chiropractic. So I think that probably steered me in that direction.
Cool. Awesome. So I have a very limited knowledge base about chiropractic, and I hear these terms thrown around a lot. I know enough to be dangerous with it, especially in our industry. I mean, you need to know a little bit when somebody has, a pain that's either muscular or, is this something skeletal? Explain to me when somebody's talking about their L5 or their C4, or how do you guys label the spine like that? Like what's upper, what's middle, what's lower? What do those things mean?
Sure. So the neck, those are the cervical vertebrae. So we label those C1 through C7. C1 would be the highest one. C7 would be right about the level of the shoulders.
Okay.
Thoracic would be the mid-back. So that starts about the level of the shoulders and goes down from T1 to T12, which is, probably just where your back starts to curve forward. So maybe about 6 inches below the shoulder blades, and then lumbar would be the lowest part, which goes from that area down to about the belt line, and those are labeled L1 through L5. So the higher number is the lower you are in each area. So.
Okay, got it. Yeah, I always hear those terms. Oh, somebody said, "Well, I hurt my L5," and I'm like,
L5's common. That's probably the most common area to get a disc issue.
Okay, okay. So when somebody goes to a chiropractor and we hear you guys are manipulating someone and we're hearing that pop, that crack, are you popping these discs back into place? Is there fluid in there that's making that sound? What's happening when you're doing that?
So in between every two vertebrae, there's actually 3 joints. The biggest one is the disc. So that's going to be fibrotic material on the outside and gelatinous kind of on the inside. That doesn't make a noise when you crack it. There's 2 facet joints behind that, which are the same type of joint that you have in your fingers. And when you manipulate a joint, you get all the sound from those facet joints in the back. And that's just a dispersal of gases in the joint.
Okay.
So the idea, what you're really trying to do there is you're really just trying to take tissue that's tight, take a joint that's not moving properly, and you're trying to loosen that tissue, try and restore movement into the joint.
How do you... I'm sure a lot of people are pretty scared the first time they go to a chiropractor if they've never been to one before. I know I was. The first time I went in, my dad had he had a ton of back issues, religiously went in to see the chiropractor. I was always scared, especially up towards the neck area. Like what do you tell some of your patients to kind of get over that initial fear? Is it just more of like I'm going to educate you type of thing?
Yeah, like we don't just bring people in and put them down on the table. I mean, by the time someone gets to the table, they've had a 30-minute visit where we're looking at the range of motion, we're doing a bunch of orthopedic tests, we're taking a joint and seeing how it's moving, taking it to end range so they can kind of see where you're going to be when you start the adjustment on there. So by the time you review all that with someone, I think they feel pretty comfortable. There's some people that come in, most are fine with it at that point, but there's some people that they don't want to be cracked at all. And we have other types of modalities that we can use rather than the cracking that aren't as, maybe they don't mobilize you quite as much. But they still help out a lot as far as restoring the motion.
What are some of those other things? What do you guys do for that?
So just basically just stretching the joint. We have you'd mentioned flexion-distraction before, so that's used in the lower back. There's a table that works on a pivot where it flexes, and you can isolate different areas of the back, move it side to side, up and down. It'll traction and mobilize the joint. That would be a big one. We use something called active release technique, where we're taking sweeping moves over the muscles and ligaments, trying to restore motion that way. There's something called an activator, which is kind of a little clicky tool. A lot of people have tried that before, where it's a light impulse that goes through the joint. And then things like there's parts of the table that will pick up and drop, which will allow you to get motion through a joint without cracking or popping it. Blocking tools that you can put people on to kind of hold them in a position for a while, types of traction. So there's a lot of different ways you can try and get a joint to move.
I always hear people with sciatica, right? I hear that's like a super common thing. A lot of people that walk through our doors, have talked to me about it. What do you guys do to kind of help alleviate some of that pain and stuff like that?
So first of all, we got to figure out what's causing the sciatica, because it's not always the same thing. So a lot of times it could be, the lower discs and the lumbar spine, which form the sciatic nerve. If it could be a herniation there, it could be inflammation down there. There's the sciatic nerve actually runs through the hip and comes out underneath the piriformis muscle. Sometimes that muscle can tighten up and pull on the sciatic nerve too. So it really kind of depends on what the condition is that's causing it. So we have to figure out that first. If it was the piriformis, we may take more sweeping moves over the muscle to try and relieve that. If it was, say L5, S1, we may use things like traction and adjusting to address it.
Okay. So a lot of what you guys do too is muscular related.
For sure. Not every chiropractic office does that. I think that's one of the things that separates us from other offices. Most of our visits are actually about 30 minutes long, and we're doing adjusting, we're doing stretching, we're doing traction, we're doing active release technique, just to basically loosen up all the tissue that might fall along that nerve.
So there's a kinetic chain, and everything's
exactly
connected, and it all affects everything. Okay.
Right. People tend to shift over time away from pain, so that's going to affect other areas of the body as well. So we'll look all along that area for sure. Yeah.
Nice. Yeah, I think that's a common thing that people they're just not educated on. They have no idea that maybe I have this pain near my back. Well, could it be nerve related? Could it be muscular related?
Right.
So you guys do a lot of like massage techniques. You talked about active release, right? So is that massaging the muscle in a certain way to get it to relax and
Yeah,
let go a little bit?
so active release, it combines stretching and muscle work. So you're basically taking a muscle and you're shortening the muscle, holding the tissue, and then lengthening the muscle to try and take a sweeping move over the muscle. So
Okay.
when you do that, you can get up adhesions like between the muscle and the covering of the muscle or the fascia, between adjacent muscles, and then sometimes even nerves that run underneath the muscles.
Gotcha. So you're trying to massage that out to get it to relax.
Yeah,
enough
it's like combining like a deep tissue, almost like a trigger point therapy with a range of motion in there.
Got it. Headaches are a big thing too. Do you get people that come see you and they're like, "Hey, I have this headache. Do you think this chiropractic stuff can help me?"
For sure. Yeah.
So what do you guys look for? First when somebody comes in and says, "I have headaches," I'd like to know if it's related to my spine, my posture, all that stuff.
The simplest thing that we look at before even doing the exam is just the location of the headaches. So there's different locations that could suggest different things. So if the headache's like in the front near the eyes, we might be thinking that it's sinus. If it's on top of the head, sometimes blood pressure can affect that. If it's cervicogenic, a lot of times it's in the suboccipital area, which is kind of that area behind the head between the ears, type of thing. Poking in, when we start the exam, it's kind of poking into the tissue. Are there muscles that are tight and tender and refer pain there? Is the upper cervical or the C1 area that we had talked about before, is that tight? Is the joint moving properly? Things like that.
Okay. Yeah. I talked to, we had a physical therapist on a couple weeks ago, and he talked about the cervogenic headaches or whatever it was too. That's a huge thing. At what point, so like my father, he had to have back surgery and stuff like that. At what point after, trying to manipulate somebody and here and there, are you recommending, hey, we might have to go in for a procedure? What types of injuries do you see?
So the most common areas, as I said before, like the very lower lumbar, like along the belt line, like L5S1 is an area that is common to need surgery. C5 to C7, like that area in the neck. Loss of function is a big thing. So when someone comes in, we test the strength in all the areas and we compare one side to the other. If you're seeing a big loss of strength in an area where you're thinking the disc may be compressing it, loss of function is a big one where we may actually get someone out right away without even treating them first. If there's no loss of function, maybe there's pain going down a joint or numbness, it's something we may want to get an MRI on there to take a closer look at the disc, but that's something we would be able to start treating there. Okay. Usually if there's an issue like that, usually within the first couple of weeks, people are going to notice a difference in there. And if it's not getting better in a couple of weeks or starts to get worse, then we may send them out for a second opinion. A lot of times that's to the orthopedist who may look at a cortisone shot or surgery. Just, they have a whole bag of tricks that they use as well too. And we refer back and forth often with a lot of orthopedists.
Okay. I've heard of people, sports related injuries. I've heard of a couple people getting fractured vertebrae. Mm-hmm. What do you have to do to heal that? Just let it rest, or is it like any other break in the body, or is it a lot different?
It really just depends on like what kind of a fracture it is. So like sometimes people get in a car accident and it's a whiplash kind of injury. And they'll get like a compression type of fracture. So that's a stable fracture. It's going to take time to heal, probably 8 to 12 weeks. But you want to keep motion through that joint as it heals, because otherwise it may heal with more adhesions or restricted range of motion. If it's an unstable fracture, it may be something that they need to get right away for.
Got it. Okay. So you guys are kind of, in a way, you're kind of, I don't want to say you are doing physical therapy, but we keep talking about a common theme. You keep saying is motion and stuff like that. Mm-hmm. Are you giving your patients like homework to do as far as like movements and exercises go after they see you?
Yeah, typically we'll start out with some stretching stuff that they're going to do at home to keep the motion in between visits. And we'll definitely do work with them as far as like doing some core training and stuff at home, but it's pretty basic stuff. It's not like, going to a trainer and having them watch you do the exercises kind of stuff. It's kind of a good starting point for something like that.
Okay. Is chiropractic for everyone? Do you think there's a place for everyone to go see a chiropractor on a regular basis?
I can't say that everybody responds. I would say probably 80 or 90% of the people that come in respond well. it's a great starting point, because if you have a problem that, we can't help, then we have, referral situations set up where we can send them down the right path too. So yeah, I think it's a great place for anyone to start. And I think most people would respond well to it, but I don't think it's the answer to every problem.
I've heard of scoliosis of the spine too.
Mm-hmm.
Talk to me a little bit about that. What does that mean? What's going on when someone has scoliosis of the spine?
So a scoliosis is an irregular curvature of the spine. You can see it sometimes, in people if they have like rib humping or a shoulder that's lower than the other, hip heights. People may notice that their shirts, like their arm sticks out more on one side. Generally, if you've passed puberty, it's not something that's really dangerous or progresses. But if it's something that's happening in kids, before puberty, at puberty, it's something that you're going to want to get checked out and get monitored through the process. Because, sometimes they do have to end up doing follow-up treatment for that kind of thing, so it doesn't get worse during puberty.
So is it just it's a curvature of the back? So like you're
hunched
over,
so if you're looking at someone from behind, it would be so it's usually an irregular curvature like that direction, but
okay.
Someone could roll shoulders kind of thing. They do have those kinds of scoliosis as well, but it's usually like looking at it from behind, so you'd see kind of a rotation.
Gotcha.
Because looking at someone from the side, you actually are supposed to have curves in your back. So you're supposed to have a backwards curve in your neck, a forwards curve, through your shoulders, and a backwards curve in the lower back. Sometimes those can be too much or too little, and that can affect the spine as well too. But that wouldn't really be part of what the scoliosis would be.
You talked about children. What's the youngest patient you've ever worked on?
I don't work on a lot of really young patients. I've worked on a handful of toddlers, but if they can't talk and speak, it's not something that I normally deal with. They do have chiropractors that work with that kind of stuff. It's just not for me. Most of the kids that I work with are like junior high and high school sports injuries kind of stuff. So. Is
there a place for treatment of people that young? Like we were talking toddlers, you think?
Yeah, it's more like general and systemic. So for really young toddlers and kids, one of the things that they've gotten really good results with ear infections. So otitis media and having the ears get clogged up. A lot of that gets backed up from the lymph system or the neck muscles not moving properly. It's not the only thing that can cause it, but they have gotten good results with things like that. So that would be one instance. But it's not something that I've worked with a lot, so it'd be tough for me to comment too much on it.
Yeah, no, I was interested in that because I've seen it before, and I've heard some people have rave reviews on it.
Mm-hmm.
Others say things like, "No, that seems pretty dangerous."
Yeah, it's so when they work on really young kids, they're not. It's not like giving an adult or an older kid an adjustment. It's usually just like really light stuff.
Okay.
But yeah.
Do you guys do any work with like dry needling or anything like that?
No, we don't do anything with that.
Gotcha. I had that physical therapist came on a few weeks ago, and he was talking a little bit about that releasing therapy and stuff like that.
Yeah, I've definitely heard good things about it though.
Yeah. What are some things? Okay, we're talking about the spine, and I find myself literally sitting in this chair, like actively thinking about my posture as we're having this conversation. What are some things that like I can do on a daily basis, or the listeners can do on a daily basis, to improve posture? Like, how can we actively think about this and do this?
So that's a big issue now, because things are becoming more and more convenient, like with the cell phones and having the computer right on there, and people are just hunched further and further forward. And in our loop office, like we're seeing people that are on the computer all day long. More and more people are on laptops, head bending forward, head coming forward. The big thing is to set that up ergonomically. You want to get the top of the computer, so the very top part of the computer about eye level. If you have a laptop, that's going to pick your shoulders up, so you'd have to have some sort of a external keyboard. Shoulders you want down and relaxed, elbows at about 90 degrees, and hands just falling on to the computer. The other thing is just, putting the body in motion. When you sit for 8 to 12 hours a day, things start to stiffen up, and, getting to the gym, doing your exercises, eating right, things like that, because that's all going to affect the musculoskeletal system as well too. So.
Gotcha. So getting up, moving around, We switched to standing desks here
Oh, nice.
at all of our locations.
Nice.
Again, posture. I mean, was a thing for us. We see it all the time. We're hunched over. We're on the computer a lot too. Even in our, if you work in a gym, you tend to be in front of a computer quite a bit too, unless you're like a personal trainer or something like that. But yeah, I find myself, and my girlfriend too, same thing. We always talk about posture. I think earlier you talked about like some core strengthening exercises. I think that's really important too. A lot of people, they think about, I want to get this 6-pack abs.
Right.
But really, we teach the most important part is strengthening your back enough to support all these other exercises and all these other movements that you're doing. And again, to help your posture too. If your abs are stronger, your lower back stronger, you'll be able to sit up straight at your desk. You won't be as tired.
Exactly.
I saw online, we were talking about posture. I saw online they had this like electric like stimulator that like gives you a little zap, and it's hooked up to an app on your phone. So if you start to slouch, it'll give you a little like vibration or reminder. It'll zap you.
I've seen that too. Yeah. I'm kind of curious, but it's
a little bit. I think it's a little bit on the extreme end.
Yeah,
But nice. Any other like myths that you want to debunk about chiropractic? Like, what are some things that like are out there in the media that people say that just flat out aren't true? Can you think of any off the top of your head at all?
Yeah, I mean, like, I think the biggest one is like once you start going, you have to keep going. And, certainly we do see some wellness patients, but most of the people that come in, I mean, I do a lot of pain management. So they'll come in. Our goal is to get them out of pain and get them back to full range of motion, and then get them back to doing what they like to do. Some will come in for tune-ups once in a while. Some need it, some don't need it. It really kind of depends on what's going on. So I guess that would be one myth. I don't know.
I mean, that was a good one. I know, like I said, some people are pretty skeptical. What I hate to see in the chiropractic industry is this: come in, we adjust you, you leave, and it's just kind of an umbrella treatment for everyone. So I kind of like your approach. You said earlier, you guys do a 30-minute consultation with people too to kind of personalize it.
Right. Right. Like the whole come in, crack and go. I mean, I think that's just more a general health kind of thing. It's very different from what we do. Our goals, I think, are much different than something like that.
Excellent. So as we wrap up the show here, I always like to ask people for, a little nugget of advice, right?
Okay.
We've covered, quite a few topics so far, but is there any piece of advice that you can pass along to the listeners that they could be doing every day to, whether it be improve posture or spine health, I guess?
Sure. I mean, outside of the ergonomics, everybody's flexed all day long. So just do stuff into extension. So whether it's stretching out your hip flexors, you could Google hip flexor stretches, tightening of the pec and pec minor from the shoulders rolling forward. You can Google that and see how to do those stretches online. I think that would be some big stuff to do on your own. Yeah.
No, that's perfect. That's perfect. We preach stretching a lot here, extending, because I mean, like you said, it's all connected back there, and something in a spot completely unrelated to where you are could be actually causing the pain.
Yeah. I see often where people will get, tight hip flexors in the front and overactive glutes, and they start to get pain in the back of the hip. So they're trying to stretch that more and more and more. And it's actually other tissue that's tight in there. So that's good.
No, that's definitely a common misconception.
Yeah.
No, that was good. I'm glad we covered that. All right. Well, hey, thanks again for coming on.
Yeah. Thank you for having me.
Yeah, I really appreciate you taking time. If people want to know more about your practice or have questions for you, where do they find out more information?
So our website is it's www.bodyfusionchiro.com. So BODYFUSIONCHIRO. You can get a hold of any of the offices through there. You can send emails, that type of thing. So that would probably be a good starting point.
Excellent. We'll link that up in the show notes on Facebook and on Instagram and stuff like that, so people can go on and then on a YouTube channel too. That way they can go on and check it out. Well, awesome. Thank you so much for being on.
Yeah, thank you for having me.
I would really like to thank our sponsors once again, Eco Gym and Motivate in You. Stay up to date on all the latest news, episodes, videos, all that stuff. We're trying to reach 1 million people with this podcast, and I can't wait for the day we see it. We genuinely started this to help others, to get this information out. And I'm glad we could have these experts on to do this. So go to our website, onehealthpodcast.com, and make sure you guys check us out. Other than that, thank you so much for joining us for another week, and take care, guys. Thanks.